Okay, good evening, everybody. I'm Swarnima Tamang, and I'm representing Swayam Shikshan Prayog. We've come from Pune, and my colleague Mrs. Naseem Sheikh is also with me here. So, um, just a quick two sentences on SSP for a brief understanding. Basically, SSP is working since 1993, majorly with women in promoting livelihood opportunities in terms of promoting rural enterprises, and we provide entrepreneurship education in across sectors and create rural women entrepreneurs in terms of providing information and awareness into energy, health services, agriculture, water, and sanitation. So today we are here to speak about the Arogya Sakhi model. So as Dr. Aparna correctly mentioned about the Arogya Sakhi approach, which we are implementing for maternal care as well. So together with maternal and child care, we also realized the importance of preventive healthcare in all these rural villages where we were working on, especially in Maharashtra. So so as I said, like earlier, for 2 decades, we've been providing information and awareness on health. But right now, since 2013 October, we said with the advancement of technology, modern technology, why not equip them with more of mobile diagnostics and a tablet with a pre-installed application. I'll just go a bit forward. So the Arogya Sakhi, how we work is the approach. We identify women, potential women from the villages, and we provide training, a conceptual training on health, on majorly focusing on preventive healthcare. This is because with the rise of BP and sugar and diabetes in all these areas, we thought looking at this area is also equally important. So after that, in terms of awareness, after they start providing, so the training is also conceptual, and also the technology partner, we have the one who has built the application Arogya Sakhi for us, so former embedded solutions from Pune as well. So they provide training on for the trainers for how to go through the application, how to capture results, how to use the tablet software. And the doctor, a professional doctor from our partner network, delivers the training to the actual Sakhis whom we identify. So after the training, so the Sakhis are well equipped with the health devices as well as concepts. So they start mobilizing the communities through community meetings and door-to-door visits. We target SHG group meetings so that women are present there. And we start with fee-based. It's a very affordable fee of rupees 150 for the series of tests where we have a general checkup of not only your health, not only your height, weight for your BMI to calculate your BMI, but also your HB level, your sugar level, blood glucose level, and your BP. And after that, the test data captures. For the syncing, so the Arogya Sakhi enters. All these machines are like small digitalized machines which we get in the urban market. So it's easy for them to just capture the results. So after the results are captured, we started with an online platform to share the results to the server, but we found certain technical difficulties in some of the villages where there is no internet. So we have come up with offline saving of the forms as well. And the data, when it goes to the server, it's accessible by the doctor, who provides comments on after looking at the data collected by the Sakhi, and then the reports after her comments are sent back to the coordinator by email, and it's printed it out and given it to the Sakhis. So the Sakhis will go again to the doorstep or to the community meetings where they meet up for the second time and deliver the report, and also provide some guidelines or the counseling directions which the doctor has provided. The tricky part is the intervention does not really end here, because if there are certain patients or beneficiaries who are identified with they have a high risk, like there's a very high sugar level or a high BP level, or they are in critical anemic stages. So we also have a unique relationship building with all these areas where we've been working for like almost 20 years. So we have local network of clinics, local hospital networks, local private doctors, to whom we link these beneficiaries through the Arogya Sakhis. So these can also, sometimes we can take help of Ashas and Anganwadis, or otherwise we go through the Arogya Sakhi whom we've trained. So that is the model as of now. These are some pictures from the field where the Sakhis are getting trained on tablet application, and they've started doing HB tests and BP pressure levels and so on. In terms of impact, in a year, we've directly reached out to 750 households. We have an online dashboard and a full database of 750 tests as of now. We are also trying to include activity details of the number of activities and meetings we conduct and awareness activities we do. So apart from that, the reduction in anemia of the first sample we had done with 3,000 have now around 17% increase we've seen. So basically, sometimes the Arogya Sakhis try to give home remedies and information on nutritious diet and so on. So that is the immediate solution which they give them. And later, once they connect to the doctor, then further information is provided by them. Apart from that, more linkages and more information on access and consumption of midday meals for the children and Anganwadi services, PDS, and all that is also there. And together with providing community service at affordable rate, we are also looking the entrepreneurship part for the women, which is the motto of Swayam Shikshan Prayog. So here we are looking at services plus livelihood opportunity for the Sakhi. So the Sakhis can only during, even if they do a minimum of 30 tests, that is one test per day, they can earn, they are right now earning like 1,500 rupees. But to give them a larger customer base and a larger earning opportunity, we've also added like some health and wellness products such as herbal medicines or Ayurvedic medicines, or a first aid kit where you have a smallest of Bernol and other antiseptic creams, which are itself not available in these villages. So together with that, we are aiming to reach out the earning capacity to 5,000 after a project support of 2 years. And we also have information and awareness on safe drinking water practices, use of toilets and access to toilets, which has also increased over the years. The whole point of having technology support together with a last mile outreach network is the women's network can be more effective and more time and cost effective both. Earlier, manually, as in the earlier presentations, we saw that it was prone to errors, but now we have reduced errors as well. We can reach out to a larger population, and it is very easy to scale up because the Sakhi network can be built in other villages, and we have all the mobile devices and tablets which can be started anywhere in other villages as well. Sustainability, as I explained, it's an affordable 150 for the whole test, and the repetitive customers who just have certain symptoms at sometimes some giddiness or sometimes any basic symptom, they can just come forward and do a single test as well. So and the model has already been scaled up. Even with a year's performance, we've received some increasing support from CSR, and we've scaled up in two different districts as well. So these are certain few words from our beneficiaries, from our early beneficiaries. Yes, thank you. I also, since the platform is for sharing the application details, so I thought I would just run through the application which we have in the tablet. So usually we have a Marathi text, the font for the Sakhis.
We'll just take a quick 30 seconds.
Yes. So they have to fill in the basic information, then they create the ID, details, and then the test. So the Sakhis will have to move one stepwise, stage-wise, so that they cannot miss out any test as well. And the photographs makes it easy for them not to get confused. So this is extra information we generate. And the numbers as it shows in the devices, they just need to record that. And initial The ranges for normal and high risk, that they are able to say like immediately, and within 2 days we receive the report and get it delivered in their houses. So,
Great.
yeah.
Yeah.